The proceeding will start shortly. 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 The proceeding
Order, order. Tonia Antoniazzi to move the motion, please.
I beg to move that this House has considered E-petition 604472 relating to immigration fees for healthcare workers. And I'd like to say it is an honour, Mr Sharma, to serve under your chairship. It is a privilege to introduce this petition and to give voice to the thousands of healthcare workers for whom this discussion represents an opportunity to raise an issue which not only has significant detrimental impact on their lives and their careers, but also has a huge impact on the availability and quality of healthcare in the United Kingdom. While the petition is focused on changes that are within the remit of the Home Office, in order to understand the reasons for this petition and to understand why this is such an important issue for both the petitioner Micton and for tens of thousands of his NHS colleagues, we have to understand that the most British of institutions, the National Health Service, would collapse without staff who are not British nationals. According to the House of Commons Library, around 16.5% of NHS England staff are not British nationals, and of those 220,000 staff, more than half, just under 120,000, were from outside the European Union. So let's break that down a bit. Figures from the GMC tell us that in 2021, over half of new doctors working in the NHS came from overseas. In nursing, there are 146,664 internationally trained professionals on the Nursing and Midwifery Council register, representing almost 1 in 5 of the nursing workforce. The Royal College of Radiologists' recent workforce census found that in England, 27,000% of clinical radiology and 20% of the clinical oncology consultant workforce gained their primary medical degree in non-EEA countries. The list goes on across roles and across specialisms, and that's before we even get to the healthcare workers who are working in social care and providing support as home carers or in nursing homes. Yes, I will.
giving way. While it's welcome that the scheme has been extended to care workers under a 12-month trial, care workers are some of the lowest paid in the sector, and the at-home care area of healthcare is facing some of the biggest difficulties of any across the UK. Does the honourable member share my concern that the costs are completely unaffordable for care workers?
I thank the honourable member
Tonia
for her contribution.
Antoniazzi.
And to be truthful with it, I do agree with her, and it has been extended by 12 months, but they are the lowest paid, and these are some of the biggest costs. So I appreciate her intervention. And the numbers can only tell part of a story. And while it's essential we know the facts and figures, I'd like the committee to think about what these numbers translate to for patients. Those clinical oncologists are the people who are helping to reduce the backlog of patients waiting checks, scans and treatment, and delivering life-saving care to cancer patients. Those midwives guiding mothers through pregnancy and helping bring their children into the world. Those are the doctors and nurses who gave so much during the COVID pandemic, who worked all hours, who didn't see their own families, who saved lives and who comforted those who couldn't be there with their families in their final hours. I will, yes.
I thank my honourable... Thank you, Chair. I thank my honourable friend for giving way. During the pandemic, I was involved with GMB's campaign to get NHS cleaners and carers to be granted indefinite leave to remain after the sacrifices that they made. Does the honourable member agree that we need to lower the indefinite leave to remain and show the same level of gratitude to health workers who are having to work in one of the most severe crises that our NHS has experienced to date?
Tonia Antoniazzi.
Thank you for I thank my friend for her intervention. It is true that, you know, these have been the most challenging of times, and indefinite leave to remain would be one way of addressing that. So, as we've discussed in this petition, I would urge colleagues to remember that when we talk about health and care workers, we aren't talking in abstracts, and to remember the very real impact government decisions have on the health and well-being of people. Now, there's very little argument that workers from overseas aren't essential to the running of our healthcare system, and in fact, NHS trusts actively recruit from around the globe. The health and care worker visa we are discussing was introduced in order to speed up processes to ensure much-needed health and care staff could work in the United Kingdom. But despite broad agreement, there is an obvious need in our overstretched health and care sectors for overseas professionals, as the current system is failing to retain these key workers. The expensive, drawn-out, indefinite leave to remain process is pushing many key workers away, creating financial and bureaucratic barriers for those who wish to stay and continue working in this country. A greater number of healthcare workers settling in the UK only benefits the health system. Not only does it better access to ILR make the UK more attractive to the international workforce retention, it provides, greater long-term security in terms of workforce planning, which I know firsthand is a key current issue. Indefinite leave to remain also allows for greater mobility between sectors and employers, with greater flexibility for internationally recruited workers to be deployed. And this is where, it's the greatest need not to be hamstrung by restrictive visa requirements. Look, the financial barrier is high. The Migration Advisory Committee has highlighted the general high cost of these fees in comparison to other countries. The current costs apply for ILR that currently sits at £2,404 per person. And however, the latest visa and transparency fees data suggests that the estimated cost of an ILR application is just £491. In the context of a decade of pay erosion and a cost of living crisis, ILR fees may simply be unaffordable for many healthcare workers. In the online survey of petitioners run by the committee, respondents said they found it difficult to save up for indefinite leave to remain fees because of low salaries and a high cost of living, especially where they would need to pay ILR fees for multiple family members. One nurse who answered said, "I work as a deputy sister, I'm a single mum, and my two kids have recently joined me in the UK. I cannot afford the ILR fees for me and my two children. With the salary of nurses and the cost of living here, a single mum like myself cannot afford it. A medical practitioner who responded said, as with the current pay and cost of living crisis, it's impossible to save this much. I am forced to buy used and second-hand items only, and I buy the cheapest groceries. Try and only use the heating when absolutely required. I am forced to work weekends to save. I am hardly spending time with my family. My mental health is affected. It feels like I'm a slave forced to labour. I don't understand why the government would keep a fee that would force workers to leave the NHS and the UK. I survived through all waves of COVID and staffing pressures. I've had multiple illnesses because of my work, and I don't think I'll survive this one. I believe these fees will break me. And the fee is not the only cost. It is in addition to other substantial visa fees paid in the years prior to eligibility. Those workers without an ILR are subject to the no recourse to public funds policy as well. The cost of living crisis brings into sharp focus the potential financial hardship that internationally educated workers who are unable to access public funds could face. Members of the RCN consistently report the negative impact that this policy has had on the lives of them and their families. The COVID-19 pandemic has exacerbated existing challenges that individuals with no resource to public funds were already facing, with families identified as being at high risk of living in insecure and crowded housing. Now, to make the ILR process more accessible would bring significant benefits to individual workers who report that their mental health is suffering as a result of the financial pressures they are facing to try to meet the costs of ILR. A healthcare assistant who responded to the committee survey said, with the ever-rising cost of living, saving for the ILR becomes mentally draining for an already overwhelmed health worker. Reducing the costs shows the government care about the well-being of health workers and promotes a work-life balance, because families have to work odd hours to meet up with the fees. The RCN also reports that nurses sponsored under the health and care visa, for example, often report difficulties in reducing their working hours due to the minimum salary threshold, which is £20,480 per annum, which is applied to their visa. Given that there is no provision in place for this to be pro rata for part-time staff, the RCN understands that this policy often conflicts with nurses' caring responsibilities. Better settlement pathways can help tackle abusive labour practices, reducing the ability of predatory employers to use immigration status to tie staff into exploitative situations. This is particularly relevant in the care sector, where the Director of the Labour Market Enforcement has identified workers as high risk of exploitation. The RCN is aware through member reports that employers will, on occasion, use threats of deportation to coerce staff into paying extortionate repayment fees where they choose to leave employment early. Now, of course, the current policy means the UK is already losing overseas healthcare staff to countries. I couldn't raise the money for ILR for the last 2 years to apply, so I've gotten a better salary offer in New Zealand, so I'll be leaving the United Kingdom. Those are just the words of one nurse who responded to the petition. The trainee doctor told us that with paying for exams and training, I don't have enough money to apply for an ILR, which makes me think to leave the UK and work in Australia after I qualify as a GP. This petition isn't simply asking for a reduced fee for those health and care workers seeking ILR. It's asking for a joined-up approach from government. It's asking for a better system that will improve not just the lives of those using it, but will enable us to provide a strong and sustainable health sector. Earlier in this debate, I told you it was essential that we remembered that behind the figures, statistics and costings, we are talking about people. And I'd like to finish my contribution by telling you about the person who kicked all of this off, the petitioner Mictin, who's here today with his family. and what Mictin told me about why he started the petition. Mictin was recruited to the NHS from India. He was actively recruited, with NHS trusts employing local agents to recruit for them. Of the 23 other overseas workers who started with him when he came to Leicester, only 6 are still working in the trust. The cost of pursuing ILR were too much for many of them, and some have found new work abroad. Skilled workers who have left the United Kingdom because we have made it too difficult to stay. We ask people to make the choice to come to the United Kingdom, but we haven't ensured that we have a system that makes that choice an easy one. We force difficult choices on the workers we need. Mictin and his wife have made the choice to stay, but we haven't made it easy for him. Mictin's parents-in-law have never seen their grandchild because the cost of taking him to India would mean greater delays to applying for ILR. Mictin started this petition because he knows he's not the only one making these difficult choices. And while our health sector desperately needs more Mictins, we have to ask why we're making the choice to stay so difficult. Thank you, Mr. Chair.
Thank you. The question is that this House has considered E-petition 604472 relating to immigration fees for healthcare workers. Roberts.
Thank you, Mr. Sharma. It's an honour to serve under your chairmanship, sir, and a pleasure to speak on a topic that I suspect will have agreement on all sides of the House, with the possible exception of the Minister, but we can't have everything, I suppose. And I thank the Petitions Committee for bringing forward this debate on such an important and timely topic, one that's very close to my heart as I declare an interest, Mr. Sharma, as my partner is a healthcare worker from the Philippines and is intrinsically involved in the system that we're debating today. Also timely, as I've got a 10-minute rule bill on this very topic coming before the House in the next few weeks. Mr. Sharma, I've spoken on this topic several times in the past, both in Westminster Hall and in the Chamber, and tabled an amendment to the Nationality and Borders Bill last year to exempt NHS clinical workers from paying the fees associated with applying for indefinite leave to remain. I discussed the amendment with the Minister at the time, the Honourable Member for Corby, as well as his Honourable friend, the Member for Torbay, who had responsibilities in that area, and was told that the amendment, which was unusual in the House as having signatures and support from members of 6 different parties, wasn't acceptable to the government because we couldn't go making special cases out of certain groups of people. Shortly afterwards, as the bill was making its way through the House of Lords, the government announced that armed forces veterans were going to be exempted from paying fees from ILR applications. Interesting, I thought, given that NHS workers weren't worthy of special consideration just a couple of months before. And the Home Secretary at the time, the Right Honourable Member for Whittam, said that waiving the visa fee for those Commonwealth veterans and Gurkhas with 6 years' service who want to settle here is a suitable way of acknowledging their personal contribution and service to our nation. Taking nothing at all away from those veterans who put their lives on the line in the service of the country and the Commonwealth, I think you'd be hard-pressed to find many members of the public who wouldn't believe that NHS clinical staff should be worthy of the same consideration. Of course.
For giving way. 28% of respondents to the Petitions Committee survey on this issue said that they had delayed making an application for indefinite leave to remain in the UK due to the high costs involved. If the public sentiment is that to resolve the crisis, fees should be lowered, does the honourable member share my concern at the government's reluctance to do so?
Roberts.
Completely. I thank the honourable lady for her intervention. Completely. This is something that I've debated with, as I say, my partner is from the Philippines, and because of that, I now have a big extended family and friends of Filipino and overseas nurse. They're all in the same boat. And as I'll explain in a moment, the type of things that they have to go through and the debt that they get into just to be able to do this is ridiculous. So I completely agree with the honourable lady. So the NHS has played a vital role, and the whole NHS deserves our thanks and gratitude, but in particular should go to our NHS workers who've come from overseas, because they're individuals who've travelled huge distances to be here, often separated from their families, and putting their own lives at risk to help and save our lives, citizens from a different country to their own. Regardless of their or our citizenship, the duty and responsibility to care and contribute to the well-being of others always comes first with them. It's an amazing thing, and it should be something that, as a society, we highly commend. And I do welcome the number of steps that the government's already taken for foreign NHS workers, the health and care worker visa, and the exemption from the immigration health surcharge, but we need to do more than that. These people want to make the UK their homes. They put down roots, and we've got a duty to put in place a framework that will allow them to do that without thousands of pounds worth of costs, just to stay in a country to which they've already contributed so much. Absolutely.
I thank the honourable member for giving way. I have so many of my constituents that contact me to say that these fees are absolutely too expensive for them in the healthcare profession. Can the honourable member say, why does he think the government keeps the fees so high and hasn't lowered them? What's his thoughts on that, please?
Goodness, I thank the honourable lady for her intervention. She imputes me with knowledge that is far above my pay grade. I'm sure the Minister will be delighted to answer that when he takes to his feet later on. I've no clue. It is ludicrous, as the member for Gower said earlier on. The cost is, what, £420 odd to process these things. I'm going to come on to the fees in a minute, but there can't be any justification. 15 odd years ago, it was a fraction of what it is now. Actually, over the last probably 5 or 6 years, the rate of increase of these fees has been exponentially more than it was before. So I'm sure the Minister can enlighten us later on. I look forward to the answer. Of course, it's worse in the honourable lady's part of the world, up in North Wales. The cost of living up in North Wales, in my constituency, is significantly less than it is down in the London boroughs. So, you know, the extra pressures and the compounding of that problem is much, much worse. I completely agree. So, with fees, as we mentioned, for ILR, over £2,400. Citizenship, 12 months later, if so desired, costs another £1,800 or so, plus a few hundred for biometrics, English language tests, and all of the other supplementary things that has to be done. The naturalisation process costs more than £4,000. It's one of the highest in the world, actually. And the process of becoming a citizen for NHS workers is costly and challenging, which includes the ridiculous Life in the UK test. So I'm not sure if anyone's familiar with the Life in the UK test. It's a wonderful thing. Ask questions like, which palace was cast iron and plate glass originally erected in Hyde Park to house the Great Exhibition of 1851? And in which century did the first Christian communities appear in Britain? And which 2 British film actors have recently won Oscars? Quite how anyone could be expected to properly integrate into British society without this pivotal knowledge, I have no clue. And yet, there we are. They have to pass this sensible test. I previously, in similar debates, Mr. Sharma, told the tale of Carrie. Carrie was a real-life case, but using a different name. She moved to the UK in 2016, leaving her husband and 4-year-old child back home in South Asia. It took another year for her to bring her husband and daughter to join because of the costs involved in a dependence visa. They could only get to be together as a family once again by taking out a loan that she paid for over the next 3 years. And 3 years later, she had to get another loan because she was due for renewal of that visa, so had a load more fees. In 2021, Carrie was entitled to apply for ILR. Loans still ongoing from previous renewals. What choice did she have? What could she do? She had to take another, even bigger than before, just to have the right to occupy a space in this country and call it home. She pays her taxes every month. She has done for years. She works in the ICU. She spends all her working life in this country saving lives, especially during the pandemic. As I've said in this and other debates before, she shouldn't be in debt. We should be in her debt. It's our duty in this place to create a new route for citizenship for NHS workers, one that won't leave workers in debt, in poverty, or, as the Honourable Member for Gower said earlier on, in mental anguish at the thought and the constant worry about funding their next application and the next and the next. So by reducing and in time abolishing completely the costs associated with ILR and citizenship, we can help to do just that. I'm very proud that our NHS attracts global talent and recruits from around the world. And quite frankly, we wouldn't be able to run it without them, Mr. Sharma. We'd be in difficulty. That's what we'd be in. We'd be in difficulty without them. In 2021, over 160,000 NHS staff stated that they were of a non-British nationality, from over 200 different countries. That accounts for nearly 15% of all staff for whom a nationality is known. But the current fees and process is such a huge barrier to both future NHS workers who are put off coming because they don't feel that they'll be able to stay long term, and for current NHS workers who are unable to afford that final step and have that permanent residency that they've earned through service to our country. Residency and citizenship shouldn't be about cost. It should be about contribution and inclusion in our communities. And NHS workers have perhaps given the biggest contribution of all, saving our lives and keeping us safe. But despite being such valued members of the communities in which they live and work, without being citizens, they can't fully be part of those communities. Without ILR, individuals face barriers to home ownership. It's almost impossible to get mortgages without this. In the job market, it's difficult. In higher education, it's difficult. It's barriers wherever you look. So reducing and scrapping the fees entirely even would not only make residency and citizenship more achievable, but would also create a more diverse and, crucially, more integrated society. People from other countries that have worked in our NHS during the pandemic and throughout their lives deserve to be able to call the UK their home and actually feel like it really is. The pandemic, it's been a horrendous thing, but it's had one benefit. It's highlighted what many of us already knew, that our NHS workers, whether British or not, are the backbone of our health service and our country. Those that have come here to provide such incredible care shouldn't be penalised for it. And currently, the high application fees do just that. It's time to reduce, if not entirely abolish, the fees for ILR and citizenship for those that work in our NHS, so that those who spend time helping and treating us can finally feel like they belong and are welcomed with open arms.
Thank you. Bal Urbaro-Ade.
Thank you, Mr. Sharma. It's a pleasure to serve under your chairmanship. I'd like to congratulate my honourable friend, the member for Gower, for how she laid out the debate initially. I think that everybody should realise that the NHS has always relied on staff from all over the world and quite literally wouldn't exist without the contribution of doctors, nurses and NHS staff from outside the UK. And this has started with the Windrush generation, who were also treated terribly by this government's Home Office. The NHS is currently in a completely dire state, and the industrial action being taken by healthcare workers is a clear example of that. At the heart of the crisis facing our health service is a struggle to recruit and retain healthcare staff. The cost of living makes this even worse. And can we not see how, with some of our healthcare workers, those paid less, having to use food banks, the in-work poverty is even greater for those who are migrant workers due to the cost of living. Simply reducing the cost of visa applications for overseas healthcare workers seeking indefinite leave to remain is not only a just and fair thing to do, particularly for their families, but will also address this recruitment and retention crisis in the NHS by actually encouraging overseas workers to remain in the profession. I would say that it lacks both humanity and economic sense to leave these key workers' lives in perpetual uncertainty about whether they can remain in the UK, simply because they have to pay extortionate fees to do so when they are people that are working and contributing to the economy of this country. Now, the government have argued repeatedly, and my honourable friend opposite made comments about that as well, that it's about making an equal and level immigration system, and that's why they're not giving any special treatment to NHS workers. But our immigration system has never been equal, and every single person making applications through it has never been exactly treated the same. And you know, this is made even clearer and reinforced by the government's own points-based system. We know, for example, that if you're a millionaire that wants permanent residency in the UK, you can move things along a lot faster just by putting millions in a bank account in the UK. We know there's a shortage occupation list. We know that there's thresholds for being able to bring your family members over. And we know that we differentiate between people who have ILR and who have a certain visa as to whether or not when they have children here, their children are automatically granted British citizenship. We have never treated everybody equally. And on top of that, we charge some the immigration health surcharge, even NHS workers. Now, there are a number of healthcare professionals right across the country, both from migrant backgrounds and not, supporting this amendment. And I'll talk to you about what one of them said to me. With the £2,400 for a permanent ILR visa, he's got a situation where they're now being asked to pay 10 times more for not just himself, but for his family. This means that for a family of 4, they're being left to pay £12,000 just to have indefinite leave to remain. And he said that NHS staff get recruited to work in terrible conditions, we can't pay our bills, and then we're charged thousands of pounds just to stay here and work. Given the terrible NHS staff shortages, this policy reaches a next level of stupidity. And I would have to agree with this doctor. Because we can't afford to lose doctors like this, especially when we know that other countries are taking steps to attract them. And we've heard already how some people are leaving us. With the shortages of NHS staff in this country, we simply cannot afford that. And we're only going to tackle chronic shortages by treating staff in a decent way, all staff. Now, the government has explained again that it maintains its hostile environment. I know it calls it something else. To make the country less attractive to people that would want to enter this country illegally. Obviously, I take issue with the people that they term illegal, but by their own definition of what a legal person in this country is, they're making it hostile for those people as well. How does that make any sense? These people are asked to come here to help support our services, and we're not talking about people that are visitors. We're not talking about people that want to take from our country. We're talking about people that are saving people's lives, people that are working in our NHS daily, people that saw us right through the pandemic, and those people have left their own countries to come and serve ours, and they're doing a fantastic job. Yes, I will give way.
I thank my honourable friend for giving way, who's making such an excellent speech and contribution. Would she agree with me that the government is behaving in a rather ironic way, really, by encouraging people with skilled professions and backgrounds to come into our country to work, but then making it very difficult for them to settle?
I thank my honourable friend for her contribution. She's absolutely right. Why are we making overtures to people in other countries and waiting for them to come here, only to treat them with complete contempt and disrespect and leave them in really serious situations, trying to support their families, making it difficult for their families also to remain here? We all understand how important it is to have our families around us, and you've already heard how some people have to leave their families behind and then face unreasonable barriers when bringing them in. These people are doing so much for us, coming to our country to serve us as NHS workers, and right down from all levels, the doctors, the nurses, the cleaners, the porters. We need to make sure, and our social care workers, let's not forget them as well. We need to make sure that we're treating them with the respect that they deserve, no matter where they happen to have been born. Thank you.
Thank you very much, Mr. Chairman. It's good to see you in the chair, and a pleasure to take part in this debate. Can I also start by thanking the Honourable Member for Gower for introducing the subject so comprehensively and eloquently, and indeed thank her and her colleagues on the Petitions Committee for bringing this subject before us for debate here in Westminster Hall. And indeed, I'll come to it shortly. I think the Petitions Committee did a great job in carrying out that survey, which has helped inform some of the contributions that have already been made, and I thank colleagues for those contributions, which are all very powerful. And like them, I think the starting point must be praising the international staff, and we have heard about the extraordinary contribution of those overseas nationals who come to join with UK nationals in order to keep our national health services brilliant, to use the word that the petitioners have used. And we've heard how significant their contribution, the contribution of overseas nationals, is in terms of facts and figures. So those figures show that around 1 in 6 NHS staff in England are non-British. And if I've understood correctly, it's pushing on 1 in 3 of doctors and 1 in 4 of nurses. Overall, there are around over 200,000 overseas NHS staff, and they come from over 200 different countries. GP practices are no different. We had a very constructive debate in here a couple of months back about some of the problems in terms of keeping international medical graduates here as GPs, and the Minister took away some points from that debate. I'd be interested to see if there's been any progress in the work being done to try and encourage more to stay, because there was a gap in how the visa process worked in relation to people wanting to stay on as GPs. But in particular, Mr Sharma, I think we should all recognise the extraordinary role that overseas workers in our NHS played, and indeed the sacrifices that they made in protecting us from COVID and treating those who had been suffering from it. Indeed, I think I am right in saying that overseas nationals were disproportionately represented in the number of health workers who lost their lives during the pandemic. And then the next part of the equation is, of course, that the NHS continues to face unparalleled challenges, particularly in terms of vacancies. Despite this huge contribution and overseas workforce, figures also show that there remain massive vacancies. As of September, NHS England had a growing vacancy rate of just shy of 12% for registered nursing staff. Full-time equivalent staff vacancies in NHS trusts in England had increased from about 133,100 in June to 133,400 in the quarter to September 2022, which I think is a 5-year high. And overall, the vacancy rate in the quarter to September 22 was 9.7%, again a 5-year high. But the important point, putting aside all these numbers, is what that means in practice. And last year, a survey by the RCN found that only a quarter of nursing shifts actually have the planned number of registered staff on duty. So that means 3/4 are going ahead with a shortage of nurses. In the ideal world, even if some of the nursing staff were to call in sick, you would have enough nursing staff to cover for them. But even when you have your full complement on, it's still turning out to be short. And instead, we find ourselves spending £3 billion every year on agency staff. Now, it is an absolutely valid point to say that the answer to all of this has to partly be about improving training and recruitment locally, and ensuring that we can rely on the domestic workforce much more in the longer term. But as the Health and Social Care Committee recently pointed out, overseas workers are essential to the health and social care system in the short term and medium-long term, because any move to shift to more domestic supply is likely to take time. So we are going to have to continue to rely, and we will continue to rely on overseas nationals filling these jobs in the years ahead. I'll happily give way to my own friend.
Thank my honourable friend for giving way. While health policy has devolved, visa and immigration policy isn't. That means that the decisions of ministers here in Westminster is having a direct impact on the devolved administration's ability to build resilience in healthcare staffing and resolve the crisis. Does the honourable member know how ministers have sought to engage with the Scottish Government on this?
I don't. I'd be very interested to hear from the Minister about that. And I'll come to, in fact, how visas are going to impact on the Prime Minister's and the UK Health Secretary's own plans for turning the NHS around shortly. But to put it succinctly, you can have all the plans and action plans in the world, but they are going to be significantly made more difficult to implement if these recruitment shortages are allowed to continue. There is a point I want to come to now, Mr Sharma, and the argument which is actually made in the government's response, and it's been made a few times in similar debates in Westminster Hall, is this assertion by the Home Office that it does not make a profit on these visas, and that seems to me just to defy the normal understanding of the word profit. The fact that the Home Office reinvests into other border and immigration functions is utterly irrelevant. The Home Office charge for this particular type of leave is several times more than the cost of processing that ILR application. It is a profit. And these profits have been increasing exponentially in recent years. Research by the Migration Observatory at the University of Oxford shows that since a £155 fee was introduced in 2003, it had risen to £840 by 2010 and now stands at £2,404. Now, at one point during the debate, the question was asked, why do we think that is? And I will be brave enough to hazard a guess. And to my mind, the reason is quite simply that the Home Office is one of the unprotected departments sat right in the eye of the storm of austerity. And Baroness Williams, the former Minister of State, pretty much said this in an answer to a written question, which he said, application fees have increased in recent years as the Home Office aims to reduce the overall level of funding that comes from general taxation. I think the long and the short of it is that the Home Office is struggling for money and therefore has been ramping up fees in an extraordinary manner over the last 10 to 15 years. And that profit margin is having hugely negative impacts, as we've heard from various honourable members today. It's the uncertainty that it causes for staff on the front line. It's the impact that it has on their health and well-being, particularly during this cost of living crisis. We heard even about the dangers of debt and exploitation as a result. And then ultimately, this impacts on patient care. And that is what this is all about. How can we be properly looking after patients when we are struggling to recruit staff and yet at the same time making it more difficult to retain excellent staff that we've already managed to recruit? So the Doctors Association UK have pointed out that the fee is more than many health professionals will make in a month, and it is pushing skilled staff to consider careers outside the United Kingdom instead. And I turn to the survey of the Commons Petitions Committee that showed 71% of foreign healthcare workers did not intend to apply for ILR because of the cost, with a further 28% saying, as my honourable friend pointed out, that they had delayed their application due to the costs involved. I will happily give way on that point.
I think the honourable gentleman for giving way. See, agree with me that it's not just the cost of the application themselves, but it's all of the supplementary stuff that goes with it, right? So when my partner applied for ILR 18 months ago, he had to do English language test again, IELTS, which he had to do when he came into the country. Not sure anyone's going to be able to convince me that his standard of English will have gone down since he passed it when he came into the country. So I would have to do that again. And then going from doing an ILR application to citizenship 12 months later, he had to do biometrics twice and pay for them twice, which is often £100 or £200 just to go to an office and hand over your documents and have somebody say, thank you very much, we'll be in touch. It's all of those other little supplementary bits that make such a huge difference. Do you not agree?
I absolutely agree. I think in terms of financial cost, in terms of complexity, it's so easy to put a foot wrong, and far too often in that process, when even a small foot is put wrong, a tiny bit out of place, it can result in you losing your leave altogether and falling off the conveyor belt to settlement and not being able ever to get back on it, and it can have really dire consequences for people if they make one mistake in this really complicated process. So I think he makes a very powerful point indeed. But the question that I think for the Home Office here in light of the Petitions Committee survey is, does the Home Office, in fact, does the Department for Health agree that that is the impact that their fees are having, that people are just deciding not to apply for ILR or to put off applications for ILR? If he doesn't agree that that's the implications of this high fee, on what basis does the Home Office reject that? Is it saying that it's done research and decided it doesn't have that impact? If so, can we see that research? If the Home Office does accept the implications from the Petitions Committee report, then what is the Home Office going to do about it, basically? Because otherwise, the Home Office is providing yet another reason for medical professionals to decide it's no longer worth remaining in the UK and to take their expertise elsewhere. And there is evidence that recruitment agencies in Australia and Canada and elsewhere are aware of these challenges. and are proactively advertising here to attract medical professionals to consider a career elsewhere. The BMA itself believes that 1 in 3 junior doctors is considering a move abroad. And this is all a function of the Home Office handing these skilled staff an incentive to leave rather than stay. And so that brings me to the point just about fees in general, but this fee in particular. I think our whole process of setting immigration fees has become absolutely obscure and not subject to enough scrutiny. Another reason why the Petitions Committee should be praised for bringing this particular fee for debate. As it stands, the Home Office is lawfully able to take account only the following criteria when it sets fees, and that's processing costs, the benefits that will accrue to the applicant and others, the costs of other immigration and nationality functions, hence its profit, economic growth, international comparisons, international agreements. I think there are problems with that framework that we should revisit, but we'll come to that on another day. And I think there are problems how that is applied, for example, in cases regarding children and families and so on. And actually, I think it was raised at another debate a couple of years ago that it's the other way around with visit visas, that we actually subsidise visit visas. I'd be interested to know if that's still the case, that people applying for a visit visa are paying less than the cost of processing that, which would mean, you know, it'd be quite extraordinary if, on the one hand, we were taking money from healthcare professionals and then using that to subsidise folk to come for a visit. I understand the Home Office wants to encourage visitors, but I really think we would struggle to justify this arrangement overall. But even just applying those factors to this particular visa for healthcare workers, I think it still makes sense to apply a far more reduced fee. The processing costs, we know, are a fraction of the fee. And in that criteria, benefits that will accrue to others. This is the NHS in crisis. What bigger benefit could you want from a fee than people to help get us out of the current crises that we face? And we're also supposed to consider international comparisons, so I'd be interested to hear what work has been done. I know, for example, in terms of citizenship fees, the UK is a wild outlier in terms of how much we charge folk to have citizenship here. I don't know if the same is true of permanent resident fees. I rather suspect it is, but I'd be interested to know if the Home Office has done some research on that. Otherwise, I'm sure honourable members will be doing that themselves. I think we do also have to speak about Brexit. My party obviously thought that the Brexit and the end of free movement was an utterly awful event, and it does make a difference here because it does make it particularly difficult to attract NHS workers from the European Union, because a talented doctor or a nurse from any one of our neighbours has 27 other countries that they can go to, barely having to fill out a form, never mind paying a fee. Now, the NHS visa helps, it's right to acknowledge that, but it doesn't change the fundamental position that we are less competitive in attracting people from our nearest neighbours. So, Mr Sharma, until we fix these problems, we are going to struggle to recruit the people we need. And all the action plans in the world announced by the Prime Minister or the Health Secretary or whoever else, whatever their merits, are going to struggle to be fulfilled until we resolve this issue. It's not just about the fees. There are other things that have been raised. For example, my old friend for Rotherglen raised the point about health and social care workers in particular. We had a debate on the functioning of GP visas for international graduates. I think I'd be interested to hear what further work has been done on that. We had about families. It's not something that I thought about, but I think that is really important, how we treat families. We expect people to come and work, but to leave their families behind sometimes, and I think that's completely illogical and counterproductive. Some steps have been taken which should be welcomed, and the existence of the NHS visa is, of course, one of them. The non-application of the immigration health surcharge is another. But I thought that was a really powerful point. We have encouraged people to come here to work by taking these steps. Why do we now discourage them from staying? It seems utterly illogical. You know, the Home Office has gone halfway down this road of treating NHS staff in this very fair and supportive manner. Let's just complete that journey. So, in closing, Mr Sharma, I think a powerful case has been made by the petitioners. I acknowledge that it's not a straightforward matter for the Home Office. There are arguments around, can a similar case be made for others? But I think the Honourable Member for Dillon and the Honourable Member for Stretton both made powerful points. The Home Office does make special rules for special categories all over the place. This is the most special of category, and it requires a bespoke response, something that the Home Office itself has argued by coming this far. Let's just complete that journey. So it needs to look at this very carefully, because real damage has been done to the NHS now by persisting with this high fee. So I hope the Minister will be open to engage on this, to look again at the fee and to listen sympathetically to the case that the petitioners has made. Thank you.
Thank you. Stephen Kinnock.
Thank you very much, Mr. Sharma, and it's a real pleasure to serve under your chairship. And I'd also like to add my comments and tribute to my honourable friend, the member for Gower, and the Petitions Committee for bringing forward this important debate today. And I'd like to congratulate her on a very eloquent and powerful speech. I'd also like to thank honourable friends from Lewisham East and Streatham for their eloquent contributions, both speaking and interventions, and making some really crucially important points. I thought some of the points, particularly around the Windrush generation, were very apposite, and also prompted me to think that it really was quite disgraceful that the Home Secretary made an announcement under the radar, really, about dropping so many recommendations from the Williams review without even having the decency to bring that to Parliament. And I thought that my honourable friends made some important points in that context. I'd also like to thank the honourable member for Delyn, who made a very eloquent and powerful case for the points that he clearly holds dear to himself, both personally and more broadly. And of course, 34,392 members of the public signed this petition, and that's really important in terms of the engagement in our democratic process. And I congratulate the Petitions Committee again for selecting this. And of course, I'd like to congratulate Midkin, who I know is in the chamber today and has done so much to organise and drive this whole process forward. The petition before us today reflects two important policy considerations within the British government's system of work-based migration. The first is the fact that our National Health Service relies heavily on the vital contribution of migrant workers, a contribution that we in this room will all, I am sure, be very grateful for. But that reliance is, of course, also a reflection of the government's failing to recruit and train homegrown talent here in the UK. Secondly, the debate today is about whether or not current policy reflects the level of respect and gratitude we have towards migrant health workers, and ultimately, therefore, whether or not the fees that migrant health workers are required to pay are fair and just. And with your permission, Mr. Sharma, I'd like to just address that first point by saying a few words about Labour's approach to work-based migration. The key point to make is that we support the principle of a points-based system for migrant workers. It was, of course, the Labour Party, a Labour government, that introduced the points-based system for non-EU citizens back in 2008. There will, under the incoming Labour government, be no return to the EU's freedom of movement when we enter government. And in government, Labour will build on the points-based system that is currently in place. But we would make sure that it is a fair, firm and well-managed system that balances the requirements of businesses and public services with the need to provide the right levels of training and support for homegrown talent, whilst recognising the critical role that immigration can play, and ensure that we treat those migrant workers with the dignity and respect that they deserve. Labour's long-term ambition is to make sure that all businesses in every sector and our public services are recruiting and training more homegrown talent in order to fill vacancies before looking overseas as the default position. But I will give way.
Thank the Shadow Minister for giving way, and appreciate all the things he's saying. With regard to homegrown talent, I wonder what his and his party's opinion is on getting rid of, or perhaps having much more of an emphasis on a non-degree based route into things like nursing, so that, 30 odd years ago, some cousins of mine have been nurses for an awfully long time. They said, we just learned as we go. You went and you learned on the job, you had a mentor, and you were able to learn all of the skills that you needed in role, without needing necessarily the academic qualifications and the book smarts to be able to complete a degree. What's this party's opinion on that method of training?
Well, the honourable member raises a very important and interesting point. Of course, it does prompt me to think about how mad it was for the government to cancel the nurses' bursary. It's very good that it's been reinstated now, but terrible damage was done by that when we're on the topic of education. But I agree with him that a more vocational route into healthcare and health working, and indeed many, many other professions. I think for too long we have not had parity of esteem between academic and vocational routes. And the fact is we have vast numbers of vacancies in our NHS and in our care system. So we need to take a broader and more inclusive approach. So I agree with him in the principle, but of course the devil is in the detail. We have to make sure that we have people who are qualified when they're doing such important work looking after the nation's health. You've got to make sure that they've got the right qualifications. But I agree with the principle of the point that he is making. Labour's, but we do recognise, as I was saying about our long-term ambition is to maximise opportunities for homegrown talent. But we recognise that if you simply turn off the tap to foreign labour without the appropriate workforce structures, terms and conditions, and adequate training in place, our public services will deteriorate further and our businesses will struggle. This is why we as a party will this year be undertaking a comprehensive review of the points-based system based on real dialogue with business, trade unions, public sector, private sector and communities and other key stakeholders such as the Migration Advisory Committee to ensure that we're ready to upgrade the system and make it more fit for purpose when we enter government. Because the current immigration system exists entirely in isolation from long-term workforce planning. A Labour government would therefore be seeking to connect immigration to wider workforce planning, to wider productivity strategies, training and recruitment strategies, all the way from job centre reform to getting people off the record high NHS waiting list of 7.2 million and back into work. Presently, healthcare is one of the professions where migrant labour plays an absolutely critical role in filling vacancies. And that's why Labour, our Shadow Health Secretary, my good friend, the Honourable Member for Ilford North, has already committed to delivering a long-term workforce plan for the NHS, paid for by scrapping non-dom status, which will enable us to double the number of medical school places to 15,000 per year, also create 10,000 more nursing and midwifery clinical placements each year as part of setting a long-term workforce plan for the NHS for the next 5, 10, 15 years to ensure that we always have the NHS staff we need so that patients can get the treatment that they need on time. Not only will this provide good jobs for British workers and fill shortages in our NHS, it will also prevent us from having to do sometimes the rather morally dubious deals that are going on with some of the poorest countries in the world, which involve recruiting medical professionals from impoverished communities who desperately need that medical knowledge to stay in country. That really does relate, of course, to countries such as Nepal, Kenya, and to some extent the Philippines, where their life-saving talent plays a very important role in those countries, and there are some morally dubious deals taking place between some of those so-called red list countries as defined by the WHO. Mr. Sharma, the contribution and importance of migrant workers in our healthcare system is even more reason to treat them with the highest level of respect and dignity. And it is important that their contribution is reflected within the specific policy that we're debating today. The fees charged to healthcare workers who apply for indefinite leave to remain. As has been debated today, under the current government arrangements introduced in August 2020, healthcare visa applicants pay a fee of either £247 or £479, depending on whether they intend to stay in the UK for up to 3 years or 5 years. And they are exempt from paying the immigration health surcharge. This is right and fair. But the petition today points out that despite the contribution that our international healthcare workers are making, they still face eye-wateringly high fees to apply for indefinite leave to remain, a fee of around £2,404. Let us not forget that individuals who are on a skilled worker or Tier 2 visa, such as a healthcare worker, and are applying for indefinite leave to remain, must already demonstrate that they have lived and worked in the UK for 5 years, that they meet certain salary requirements and that there is a continued need for them to continue in that role. So what the government is in effect saying is, we still need you, we want you to stay in Britain, your job is critically important to us, but your time is up and you need to pay us £2,404 if you want to stay. UK Visas and Immigration Transparency data shows the estimated unit cost to the government for each indefinite leave to remain application is £491 as of November 2022. The data published in February 2022 estimated this cost to be £243, which is the figure that is referenced in this petition. Now, I'm sure the Minister will recognise that even the more recent figures show a huge markup, the difference between the cost and the charge, a cost that has to be shouldered by the hard-working international health and care workers who do so much to support our NHS and our care system. Now, the government claims that the Home Office doesn't make a profit from all this, and that this money funds part of the wider border and migration system. But the markup, nevertheless, on these fees really is enormous by any benchmark. We recognise, of course, budgeting implications for any change to this and to the current policy. And it is, therefore, a policy that Labour will need to look at closely when we enter government. As a party that believes in the sound management of public finances, we have no choice but to take this cautious approach, given the extent of the financial mess and fiscal mess that we will be inheriting. But to help us develop our thinking, I'm very keen to hear from the Minister on the following points. Firstly, does he think that the current system and the fees associated with it are fair, given the extent of the markup that's being made? And does he have any plans to review this? Secondly, has the government undertaken an impact assessment on reducing the fees, not just in terms of border and immigration budgets, but also looking at the wider benefits that a reduced turnover on migrant workers would bring to the healthcare system and community integration more broadly, and of allowing migrant workers more money in their pockets, which they would spend in the local economy? Thirdly, does the Minister feel that some of the language used in recent months by the Home Secretary about certain types of migrants, use of the word invasion springs to mind, would be a help or a hindrance in persuading much valued, hard-working migrant workers to spend £2,400 to continue supporting our country's creaking health and social care system? Fourthly, when will the government publish its response to the Migration Advisory Committee's April 2022 report into adult social care and immigration? And finally, when will he and this government follow the Labour Party's lead in bringing forward a long-term NHS workforce plan, a plan that will encourage nurses to train up and stay in post, ease the burden on staffing and significantly reduce our record-high NHS waiting times, reduce our dependence on recruitment from overseas, and actually bring the quality of health and social care that the British public truly deserve? Thank you, sir.
Thank you. Minister.
Well, I'm grateful to the Honourable Member for Gower and the Petitions Committee for sponsoring this debate and the characteristically constructive tone in which she opened it. It gives us the opportunity to discuss this important issue, and I recognise the high degree of interest evidenced by the thousands of people who signed the petition. And like the Honourable Lady for Gower, I welcome Micton to the Chamber today and thank him and others for creating this petition and bringing it to our attention. The government provided its initial response to this petition in February 2022, and I'm pleased to do so again today, having listened carefully to the many thoughtful contributions that we've had. And from the outset, let me say, as others already have, that we, of course, are extremely grateful for the contribution to the National Health Service and indeed to the whole country made by the many, many NHS workers who have come here from all over the world, not just in recent times, but from the very foundation of the NHS, as was rightly said earlier on, including those who came in the early generation of Windrush arrivals here to the UK. Whilst we do want to see better domestic recruitment, training and retention of healthcare workers, and as others have said in this debate, it is essential that we build more healthcare places at UK universities and colleges in the years ahead. It's fair to say that international workers will continue to play a significant role in the NHS for many years to come. And it's for that reason, as I'll come on to say in a moment, that the government's taken a number of steps to support those individuals coming to the UK and their employers here in their efforts to recruit them. And we want to ensure that the UK is a welcoming place for them and that they're provided with all of the support that they need as they enter the UK, make their significant contribution to the NHS and indeed, in many cases, choose to make a life here with their families and move forward through our immigration system to indefinite leave to remain and through to citizenship in the years that follow. I'd be happy to.
Minister for giving way, and I'm hoping he will come on to the point of biometric residence permits, but I just wanted to draw his attention to it that obviously when NHS workers come and their biometrics is being delayed, then it prevents them from engaging in society, being able to open up a bank account, get their children into school. I mean, it has such a knock-on effect. And I was just wondering if he'd be able to say something about the Home Office being able to manage that work and to be able to speed this up so that it has some immediacy with NHS workers.
Yes, well, I'd be more than happy to say something on that now, both in answer to her and, in fact, to the Honourable Member for Dellin's point that he made earlier. On the question of providing for biometrics, the Home Office, as I understand it, is meeting its service standard, but I have nonetheless had correspondence from a small number of colleagues across the House who have said that recent arrivals in the UK are struggling to obtain appointments. And so it is something that I've taken up with my officials and asked them to improve the quality of the service. And if she has specific constituents who are struggling to get the service that they want, then I'd really encourage her to come to me. With regard to the Honourable Member for Dellin's point, that individuals might have to repeatedly give their biometrics with each application. I'm told that although the department is increasingly using robust biometrics, we have also started reusing biometrics to reduce the need to reprocess them time and again. So I hope that that will be an issue which will decline over time. To turn to the main point of the petition, the costs of indefinite leave to remain, it's important to say that ILR is one of the most valuable entitlements that we offer, and the fee for this application generally reflects that. Fees are set in line with the charging principles that are set out in the Immigration Act 2014, which includes the cost of processing the application and the wider cost of running the Migration and Borders system and all the benefits enjoyed by a successful application. The Home Office doesn't profit from these fees. All income generated above the estimated unit cost is used to fund the wider Migration and Borders system and is vital in order for the Home Office to run a sustainable migration and border system which keeps the UK and all of us safe and secure. Before I give way to the Honourable Gentleman, I'll just finish the point. The full operating cost of our migration and borders system in the published data in 2021-22 was £4.8 billion. And so the fees under debate today are very significantly lower than that. But they make an important contribution to the whole body of work that goes into an efficient and safe border system. I'll give way to the Honourable Gentleman.
I thank the Minister for giving way. I used to work in financial services, and this term is very commonly used in financial services. Is the Minister seriously telling me that the NHS workers are being used to cross-subsidise other areas of the system? Have we not got anywhere else that we could potentially draw additional funds from other than levying higher fees on NHS workers to subsidise others? Is that really what he's saying?
Well, the Honourable Gentleman makes an emotive point, but the reality is that we have to fund our immigration and border system somehow. And we can either do that through general taxation, through the fees that we levy, through all of the points of entry into the UK and our visa system, or we can find it through other means, undetermined. And we've chosen to do a combination of general taxation and the fees that we charge for our visas and immigration service. And I think that's right, because we don't want to put further unsustainable pressure on the general taxpayer. I'll come on in a moment to the very specific support that we provided to health and social care workers and how that sets them apart from almost all other recipients of our system. But we do have to fund this very substantial cost one way or another, and it's right that a significant proportion of it comes from those who benefit from it. It's also important that we fund it appropriately, because it's in all of our interests that the system operates efficiently. And we've seen in recent years, as we've been in the long shadow of COVID, how challenging it is when we are not processing visas and immigration applications appropriately. And we also see every day how important it is to have a safe and secure border and a well-resourced border force and immigration enforcement system. I'll give way to the Honourable Gentleman.
The crux of this matter, I think, are the figures that were produced by the Petition Committee survey, which suggested significant numbers are deciding not to apply for ILR, healthcare workers, and others are putting off applications. Is that a problem that the Home Office recognises? If not, on what basis is it refusing to recognise that as being a problem? But if it does recognise that as being a problem, surely they have to think again about the fee and implications of that.
Minister.
Well, I'll come on, if I may, to that point in a moment, because I'd like to answer that directly. It is something that we've given careful thought to and responded to in recent years. The petition rightly notes that the government has taken significant measures to ensure that health and care staff are supported, and this has included automatically extending visas at no cost, reducing fees to those who've already paid to extend their visa, and a bereavement scheme which allowed relevant family members of NHS care workers who pass away as a result of contracting COVID-19 to be granted ILR free of charge. As with any other visa or immigration product, we also do give a route for those in exceptional circumstances who can't meet the costs. Further to this, of course, the government did introduce the health and care visa itself, which is the subject of today's debate, back in August 2020 and extended the commitment in January 2021. It is a very successful visa route in its own terms. The most recent published statistics say that 61,414 visa applications were made, and they account for around half of all of the skilled worker visa applications to the UK during that period. The package of support that we've built up since we introduced the route has made it substantially quicker and easier for eligible people working in health and social care to come to the UK with their families and indeed in time to extend their leave. And we at the Home Office have worked closely with the Department for Health to ensure that this is as flexible as we possibly can. In my prior role, by happy coincidence, as the Minister at the Department for Health, responsible for recruitment of nurses and care workers and clinicians to the NHS, I saw that for myself when we met with representatives both from organisations here in the UK and those in other countries with whom we were transacting. And on that point, I would simply say that we do take our responsibilities very seriously to avoid depleting those countries who need healthcare professionals the most of those individuals, and have focused our efforts on those countries that feel able, and where we are able to verify that, to export trained individuals to the UK. A prior debate, which was referenced earlier, around barriers to the visa, particularly focused on GPs and smaller GP practices who might struggle to navigate the system, has been followed up on by my officials who are now working with the Department for Health, the BMA and others to explore whether there is demand and practicality in pursuing an umbrella route for that area of the health service. Now, the application fee for a health and care visa is significantly cheaper than those for wider skilled worker routes, with a visa of up to 3 years costing £247 and for more than 3 years £479 for both the main applicant and their dependents. This amounts to around a 50% reduction on the equivalent skilled worker fees. There's no requirement to pay the immigration health surcharge. The subject of dependents was raised earlier in the debate, and the same reduced fee and faster processing times apply for dependents of health and social care visa holders, and dependents have access to all the other benefits as well. This offer was further improved when we added care workers to the list of eligible occupations in February 2022, based on a recommendation from the Migration Advisory Committee. And I'd also refer honourable members to the delivery plan for recovery covering urgent and emergency care services that was published today, and the work that I and the Home Secretary have been doing with the Health Secretary to deliver that. The Honourable Lady referenced those people who have sadly left the country in part because they couldn't afford the fees for ILR, a point that the Honourable Gentleman has restated in his intervention. And I'd highlight that when we introduced the points-based system, we removed the time limit an individual can spend on the skilled worker route. Under the old system, a person would need to have been able to apply for settlement after 6 years or leave the UK. Under the current system, if a person is unable to apply for settlement for any reason, including potentially that they couldn't afford to, they have the option to continue being sponsored until they're able to meet the requirements for settlement. And so there's absolutely no reason why an individual should feel compelled to leave the UK if they're not yet able, for whatever reason, to begin an ILR application. I'll give way to them, gentlemen.
I mean, he's been very, very generous with his time. There are reasons, though. It's not just cost. You can't get a mortgage on a series of temporary visas unless you have full right to remain. There are various things that you can't do in the financial system without having that permanent residency. So it's not just about being allowed to stay, it's being allowed to stay and fully take part in society is I think, the thing that's missing in the Minister's answer.
Well, I appreciate that point, but I do think it's an important point of clarification that no one listening to this debate or reading it should feel that they will need to leave the UK at any point. They can continue to remain here for as long as they're able to be sponsored, and should demand remain as high for health and social care services as it is today, it's very likely that they would be able to do so. But I appreciate the wider point that those who come here for a sustained period of time, who feel committed to the United Kingdom, would want to progress to indefinite leave to remain, and indeed to citizenship. And we in this government, I think across the House, don't take a passive view of ILR or citizenship. We want to encourage people to ultimately commit to the UK to the extent that they choose to become permanent residents and indeed citizens of the UK. On the point about waiving fees for ILR, which is the substance of the debate, this would clearly have a very significant impact on funding of the migration and borders system. As I said earlier, we have been able in recent months to negotiate the funding from the Treasury for the significant reduction in the initial visa fee. But any further reduction in income will of course have to be reconciled with additional taxpayer funding, reductions in funding for public services such as the NHS, or increases in other visa fees. So much as one would want to do so, it is, I'm afraid, very challenging for the government to be able to progress that. I'll give way one last time.
The Honourable Member for Dillon made a very valid point earlier on that you have to look at the wider picture here. I mentioned the figure of, I think it's £3 billion been spent on sort of bank nurses to backfill vacancies. So by actually taking some money and losing some money from the Home Office budget, you could be saving money from the NHS. So you shouldn't just look at it in isolation. It should be a cross-government review of the implications for taxpayers.
Well, it's for that reason that we took the decision to apply a 50% discount in the initial visa fee, taking into account the broader benefits to the public sector and the taxpayer of bringing more people into the country on a faster, simpler route. I haven't seen evidence, to his point, that individuals are leaving the country because they can't access ILR at the present time. But if he has research that suggests that there is a material issue, then I would strongly encourage him to bring that to my attention or to the Department for Health. I'll be happy to give way, but then I should bring my
just on a similar thread, really. 2 weeks ago, I met with second-year medical students studying in our country, and they were saying to me that as doctors, they're not planning to remain in the UK to practice as doctors, the majority of them, and that is because of the various pressures and strains on the NHS, feeling undervalued and so on. So therefore, it's very likely that we're going to continue to need people from overseas to work in our NHS service. So on the same thread of which the Honourable Member was speaking, actually, we need to do more and to make it easier for people to support our treasured NHS service.
Well, I think the Honourable Lady makes a very valid point, and of course we want to make sure that we can retain as many NHS professionals, whether they are those who grew up in the UK or have come subsequently from overseas. And there is a significant challenge with, for a range of reasons, individuals choosing to go to other countries. Of course, we have to balance that in government with broader affordability, taking into account the cross-government cost and how we would replace that income from broader general taxation. On the point about international comparisons, the fees that we charge are broadly comparable with other developed countries. There are, of course, competitor countries who charge less, as there are more. For example, if you take some of those countries where, anecdotally, doctors and nurses frequently go to, as opposed to working in the UK, the RILR fee is higher than that of New Zealand, but lower than that of Australia. So it's not clear that the position in the UK is substantially higher than those destinations that healthcare professionals might otherwise go to. And on the point that the member for Dillon made, implying that there'd been a substantial increase in our fees in recent years, that isn't in fact the case. The ILR fee has increased by £15 between 2018 and the present day. And so we have tried, as far as possible, to keep the costs under control in recent years. He also asked about the life in the UK test, and I'm afraid I do disagree with him on this point. I think that integration into UK society, knowledge of our history and pride in our country is extremely important, and the decision made by, in fact, the last Labour government to introduce the life in the UK test was the right one that we have supported consistently whilst we've been in government, and long may that continue, because it does make a small contribution to encouraging people to better integrate and understand the country in which they're committing. In closing, can I offer my thanks again to the Honourable Member for Gower for securing the debate, and to all of those who've spoken. There's no doubt that we are in agreement of the importance of the NHS and its workforce, and that we care deeply about those individuals who choose to come here from overseas, and I pay tribute to them, thank them for their service, and I hope I have set out some of the ways in which we as a government are working to ensure that their time in the UK is as fruitful as possible, and if they choose to make a life here in the UK, that is as seamless as it can be, within the confines of our fiscal situation and affordability for the taxpayer. I can also assure all honourable members that we will reflect carefully on the points that have been raised in this afternoon's debate, and will continue to do what is necessary to support our fantastic NHS.
Thank you. Tonia Antoniazzi to wind up.
Thank you, Chair, and I thank the Minister for his remarks. However, it is disappointing because, and I share, probably the only one I share view of the Honourable Member for Dellin's views on this, his concerns that he raised in his intervention to the Minister about the cross-subsidisation of that cost. I understand the theory behind it, but I don't think it makes Micton and his family and others like him feel any better, particularly when, and I know that the Minister can't respond now, but he might want to intervene, particularly when we see, you know, the amount of money that has been, that has been spent on the Rwanda scheme, which is not even up and running, of £140 million. It does stick a little bit and makes people feel that when they know that that money is being cross-subsidised, it doesn't really kind of, it hurts, and I know that it will hurt those people listening to the debate today. So, good governance, I think, looks and reflects, and I appreciate the Minister's closing comments when he said, that you will reflect, that he will listen to the comments and officials will listen to what has been said in here today. But good governance would be to reflect and amend, if possible, the current legislation that we have, which I appreciate what has been done, but I think that there can be more done. After having sat and listened and spoken to Micton and his family, it's the cumulative cost of everything, and it's the ongoing pressures financially that these people are facing when their families are here, are settled. Because the United Kingdom is a great place to live and grow up, and it's where we want people to live their best lives. And those that have served, and I use the word served because to work in the NHS as a healthcare worker especially through what we've been through in the last few years, has been a duty, and they deserve better. But thank you, Minister, and thank you, Chair. I'll close there.
The question is that this House has considered E-petition 604472 relating to immigration fees for healthcare workers. As many as are of that opinion say aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order.
The proceeding has ended. The proceeding has ended.